Are you currently in physical therapy and you've been given that exercise program for those exercises to do at home? Has the thought ever crossed your mind, do I really need to do these exercises as often at home as my therapist has suggested? If that question has ever crossed your mind, then stay tuned because I'd really like to give you my answer to that question. Welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist for the past 25 years, and I have gotten that question in one form or another quite often over the years, and my answer to that question is always a resounding yes. When I hand my patient that home exercise program or that list of exercises that I want them to do at home, I always say to them, what you do at home is just as important, if not more important, than what we do in the clinic. And so do the exercises like I have suggested at home. When a patient of mine doesn't do the exercises at home, it can actually prolong or even prevent complete healing. So why is it important to do that home exercise program or do those exercises at home? And that's because your therapist thoroughly knows the body and thoroughly understands the healing process. So they know just what that tissue, that injured tissue, or the reason you're having pain, they know just what that needs. And whether that's just an increase in blood flow to the tissue to help speed up that healing process or help that process along, or whether it's just muscle activation or what we call pumping of the muscle to increase blood flow and then to decrease pain. Sometimes it may be just for strengthening or endurance. Depending on the goals that your therapist has established for you, then they know exactly what exercises you need as well as the sets, repetitions, and the frequency you need to reach those goals. In the exercise programs that I have for you on InjuryGuru.com, I will always recommend that you perform certain exercises for sets and repetitions as well as frequency throughout the day. So in the beginning, it's usually 3 to 4 times during the day. For the first 2 to 3 weeks usually, and after that, for another 2 to 3 weeks, I will suggest specific exercises at sets and repetitions, and you'll be able to perform those 1 or 2 times a day at that point. And that's just from many years of experience, knowing what the tissues need in order to heal, depending on your problem or your diagnosis. We know what that tissue needs, and in order to reach those goals that we have established for you. I always state in my video exercise programs that if you get to the end of an exercise program and you've performed the program like I've suggested at home, but you have little to no relief in your pain, then just do yourself a favor. It is time to call your doctor. You probably just need more intervention, or you may need to see a physical therapist for them to get their hands on that joint and that injured tissue to do you some good. From my many years of experience, I know that if you're performing specific exercises at specific sets and reps and frequency, that if you don't have a decrease in pain, then you need to see your doctor. The tissue is not responding like it should, and it just becomes real clear that you just need something more. If you don't perform the exercises as recommended, it may give you, your therapist, or your doctor just an unclear picture of whether this process that you're going through, this rehab process, is even going to work for you. And it can, like I said, delay or prevent healing. So just know that if that question ever crosses your mind, that this therapist would definitely say, yes, you need to do the exercises at home like your therapist has suggested. If you are suffering from some joint pain or pain from an injury that just doesn't seem to be going away, then check out my website, InjuryGuru.com, and just look around, get started, and see if we can get you feeling better, decrease in pain, and get you back to life and doing all those things that you need to do.